CMS Quality Payment Program website, qpp.cms.gov. Write that down, okay? So we are talking again about MACRA here, the Merit-Based Incentive Program, which is 96% of practices, small practices. Then there is the Advanced Alternative Payment Model, which applies to only 4% of practices. The Merit-Based Incentive Program did replace again PQRS, Meaningful Use, and the Value-Based Modifier, which was a new guy on the block. Some of you may or may not be familiar with that. You want to do these starting January 1st, 2017 and continue on through 2018. There are 4 categories in which the MIPS program looks at, and because we're going to talk about primarily MIPS because it's going to apply to most people. You can look through their website. It's decent. It's, I want to make this a little bit more user-friendly. You can, divvy this down. Who can participate in this program? We talked about this in the other video. Physicians, PAs, nurse practitioners, clinical nurse specialists, doctor of chiropractic, doctor of podiatric medicine, certified registered nurse anesthetists, DDS, the dentists. All these folks can participate. If you're a therapist, you don't qualify. No physical therapy, occupational therapy. And once again, you got to meet both criteria, billing $30,000 a year per individual, and not or, it's and, you take care of 100 or more Medicare Part B patients per year. So you have to have both of those to qualify. Who are the folks that can't do MIPS? Are those folks that are newly enrolled in Medicare. They're not going to be able to do it. Folks that are below this threshold, the 30 grand a year, and the 100 Medicare Part B patients per year. And then, of course, folks cannot double dip, meaning you cannot participate in the advanced APMs and do MIPS at the same time. Okay? MIPS, you're going to start on January 1st, 2017, carried out through the year. They give you 3 months follow-up, and at 3 months you can then submit your data, okay, on March 31st, 2018. Mark your calendars now. Put it on your iPhone, your Android, your whatever, I forget, Google phone, and whatever there is between now and then. This data, all this information that I'm talking about, is effective as of December 2016. So folks, if there's some other additional information, or this goes away or something changes, refer to the most recent information, okay, which you'll see this on this website. You'll hear it about in the news, etc. Okay, and then you'll get the feedback in 2018, and then 2 years later you're going to either go up, go down, or stay the same. Okay, that's your timeline right there. I'm going to skip down to this. You got basically your pick your pace in MIPS. Not participating, you're going to get a negative. You're going down 4% down 2 years later. Okay, you submit something, so you're not doing like a full 90 days. You're going to remain net neutral. You're not going up or you're not going down. Partial year, meaning you're only doing 90 days worth of data. You can either be neutral or positive payment. So you want to do at least minimum of 90 days, I would say. And then if you submit a full year worth of data, that's where you can go up. Okay, assuming you did it correctly. These folks, they get a little bit more money, but that's, once again, only 4% of the people. And I don't know if this chart looks familiar. Folks who participated previously in Meaningful Use had the same thing too, and PQRS had the same thing. So here's the percentages for MACRA: 4% in 2019, up or down, 5% increase or deduction in 2020, 2021, 7%, and then 9%. Okay, we're going to go forward. So these are the 4 categories in which MACRA is based out of. Okay, we have the quality program. Okay, this guy is 60% of the value, of the weight of the value. So you really want to focus a lot about this. It replaced PQRS. Those are all your different measures. You're going to submit it through a registry similar to PQRS. Improvement activities. This is basically a new category. We're going to talk about that. This is 15% of the weight for the MIPS program. The advancing care information, okay? This replaced meaningful use. This is 25%. And then cost is 0% for 2017. Come 2018, this is going to have a percentage value as far as the weight of how it's going to score your what we call a composite score for your MIPS. And this replaces what we call a value-based modifier. So once again, quality is 60%, replaces PQRS. Improvement activities is 15%. Advancing care information is 25%, replaces the meaningful use. And then cost is 0%, replaces what we call a value-based modifier. 2018, this is going to have some value. We don't know yet. That's the thought process, at least. Okay, and that's why this is grayed out, because 2018 is where it really counts. Here's those advanced alternative payment models. It's only some folks that are going to qualify. These are the ones that are going to qualify here. You can click on this, go to qpp.cms.gov, click on learn/APMs, and you can click on this if it does pertain to you. If you don't even know what these are, you're not in them. Okay, so we're going to jump forward. Okay, if you want to join them, here's information. It talks about their payment increases. It can increase a lot, a little bit more than traditional MIPS. Okay. What can you do now? So there's two ways to report. Same thing like meaningful use, PQRS before. You have group reporting, you have individual reporting. Individual reporting means that you have a single NPI and a single tax ID number that you bill through. Okay? And then you have reporting as a group. Group is a group of folks, healthcare providers, that have individual NPIs, but they share a common tax ID. Just a note about this, so if you are, each individual has to meet the criteria of the $30,000 per year in revenue from Medicare Part B patients, and, once again, and more than 100 Medicare Part B patients per year. So just keep that in mind, okay? How do you know if you're ready to participate in MIPS? First of all, if you do not have an electronic medical record and you're using paper charts, okay, you got to get with the 21st century, okay, because there's a lot that you're not going to be able to do. You're getting behind. If you're going to retire or something, I'm not even sure if you should participate in this. If you're going to retire soon, it's going to hurt you, affect you up or down or neutral 2 years later. Okay, but you need to have a certified EHR. There's 2014 ONC, Office of the National Coordinator, and ONC certified 2015, which is not all EMRs. But either one will qualify you to do this. Okay, then you need to use a registry. There's many registries out there. I've used PQRS Pro. There's another one called Cosentix. There's various ones. I don't make any money from any of these folks, and I don't endorse or, condone or anything, any of these folks. But you can Google up clinical registries for this, okay? And then here we're going to go over the measures more in detail, and we're going to go over this, okay? So quality, once again, this is 60% of your score, okay? And all four of these things, quality, cost, improvement activities, and advancing care information, make up what they call a MIPS composite score. And this basically affects the real deal. I call it the real deal because it's your money. It's going to affect in 2 years later, 2019, you're either going to go up, go down, or stay the same. Okay? This quality category replaced PQRS. Okay? And you have to pick about 6 of the various, roughly 300 different quality measures. You just have to pick 6 of them. You got to do it at least 90 days, but once again, we would like you to report for an entire year starting January 1st. Okay. Let's keep going here. Here's stuff, again, more about the APMs. That doesn't pertain to you. You can skip that portion. Okay. And we're going to go to the improvement category activity. Okay, and subsequently we're going to go over what these categories look like, but this is just the overview. The improvement activities category, says that basically you got to do at least 4 activities for a minimum of 90 days. We, of course, want you to do it for a full year. Okay, here's all these special circumstances. If this doesn't apply to you, just skip over it. Okay, the required security measures, and now we're in the advancing care information. So the required measures you have to do, we want to do it again for 1 year. There's security risk analysis. Okay, if you don't know what that is, you can look it up online. Essentially, there is a great book out there. I don't make any money from this book. It's called a Handbook for HIPAA slash hyphen high tech security. Okay, it's written by an author called Margaret, Margret. Last name is Amatayakul. You can find this at the AMA website. This talks about HIPAA, and there's a chapter actually on there about security risk analysis. Okay, and it talks about your hardware and software, and that's basically to avoid breaches in security. Folks have probably seen, various doctors' practices, other practices. Someone broke into their computer system, or they left a jump drive somewhere and someone stole it. This is serious business. You can get fined big time, and you're basically violating the law. All the EHR is pretty much out there as long as they're certified 2014, 2015. They have ability to run an audit log, and you can see who accessed what patient's chart, what date, what time they did it, and you can adjust the user access. So that's a portion of the security risk analysis. There's other things, making sure that you're using passwords, things are getting changed, you're running virus scanners, etc. Okay, and it's a big deal, because we're having patients' sensitive information, the name, their date of birth, their social security. If that stuff gets in the wrong hands, you can imagine what kind of problems can occur. There will always be hackers, but you want to have the most secure as far as the money can buy. It shouldn't cost a ton of money. I want you to embrace yourself with the knowledge to understand security risk analysis. I talked, mostly about that because these other things a lot of you are already familiar with. E-prescribing, just sending electronic scripts through the EMR, providing patient access through a patient portal system. You're sending summaries of care, and the patients are accepting summaries of care. I don't even print these out anymore. I used to. Waste of paper and time and money and printer cartridge, ink. Just send a copy through the patient portal unless the patient specifically requests to get a summary of care. Okay? Almost all the EMRs, they have the same feature. Look into that. So if you've been spending all this time and waiting for the printer, and then you get a printer jam, etc., cut your time a little bit. Okay? Here's, you can choose to submit up to 9 measures for a minimum of 90 days for additional credit. We want to do the whole year. Okay? Bonus credit for those eager beavers. We got the Public Health and Clinical Data Registry. We are talking about here like the immunization, vaccination records, etc. Sometimes the EMRs, you have to turn this feature on. Others, it's already built in. Check with your EHR vendor. Okay? Here we talked about certified EHR technology. That's 2014, 2015 ONC certified. Okay? Cost, how they follow up on this for 2017, they just look at your claims that you submit to Medicare, what you billed, what you charged, what you received, etc. 2018, the estimation is that this will create some percentage value. Now we're going to go into the quality measures section. 60% again. This is the biggest piece of the pie here. Okay, there's a ton of measures here, folks. So you want to look at this. Some may pertain to you, some may not pertain to you. Play around with this. You can filter it by certain things. You can filter it by, you want to do high priority measures, etc. Look through all this. Okay, your specialty. So if you're cardiology, you're not going to do the same thing as a rad onc. Okay, plastic surgery is going to be different than orthopedics. So look at this and see which measures are you going to do. And this is showing right here already 271 measures. Okay, so you can review this at your perusal. I'm not going to read every single one of these to you, but there's a ton here to participate from. Okay, then you're going to come down all the way, And we're going to go to the bottom. We're going to go to explore the advancing care information. Okay, and advancing care information is 25%. Okay, again, we talked about that. Here's your measures. Okay, and there's a lot of measures here, the things that we talked about. A lot of this that, sending the education, the clinical summary, patient access, secure messaging. These are all things that the EHRs already have. If you did meaningful use before, this is going to be duplication, essentially. Then you got the clinical improvement activities, and this is only 15%, 15%. Here are the things here. This, for example, this one is quality initiatives. These are different programs that MACRA has set aside, different organizations, and we'll get to that in a minute. I'll show you the website that basically assists providers in participating in MACRA. So that's what that's essentially about. Prescription drug monitoring program. If you deal with pain management, narcotics, controlled substances, you're going to look up on whatever your state's drug database to look into that. So that's a measure or an activity. There's so many things here. Care transition. I'm not going to go through all these, but care transition, you're going from the hospital and then they're coming seeing you in your office, for example. It's a transition of care. That's one example. There's a lot more depression screening. Are you doing the Beck's inventory, for example? Diabetes screening, A1C, If you're a primary care, internal medicine, family practice, focus on these things that you commonly see. Diabetes, high blood pressure, high cholesterol, depression, etc. Okay? Some of these may or may not pertain to you based on your specialty. We're going to come all the way down. Tobacco abuse. That's important. That's a billable code, and it's just good medicine. Now we're going to go to Education and Tools section. You can read the 2,500 pages if you want. It's great bathroom reading here. The legislation, real exciting. Or you can go to this website, you can dissect it a little bit easier. Hopefully this video helped a lot for you. Here's more details about APMs, etc. They have these little fact sheets. You can download these things. They do have videos. I think one of them is a bad link, I believe. It may be fixed now. And they have a phone number you can call in. I must say that for example, for the meaningful use, when I was doing meaningful use, the people at the meaningful use phone number were very helpful. So the QPP, we'll see. I haven't called in, but they had some knowledgeable folks. Okay. So that's where you want to go. I'm going to show you an additional site here, which is for more help. And this is going to talk about, there's going to be a picture, a map of the USA. And this is going to show you where you can get more information. This is called a Transforming Clinical Practice Initiative, or TCPI. Okay. As you know, I didn't go into all the math, that kind of thing. There is detailed math as far as how they're calculating the score. You can see that here on this CMS qpp.cms.gov website, this MACRA website that I just went through. But I didn't want to bore you with all that. Want to give you just a brief overview. And they have they're designed to support more than 140,000 practices all over the country over the next 4 years, basically showing how to participate in this. So this is, they spend a lot of money. I think there's so many $1 million to get these organizations to help to teach folks how to do this. This is the website here. Write that down. Okay. Pause the video right here and write this down. You can click on your state here. Organizations are present that can assist you. And you can go through this website here. It kind of talks about, how they're going to do this. I think this is still kind of under construction. It's not fully laid out. We've had different legislation, election came, and this data is accurate as of December 2016. Folks, I hope this helps. This concludes the video. You can find more videos and other information for practice building, practice management, billing, coding, how to make more money in medicine, how to survive in private practice, how to cut your costs. From me, Dr. T, Dr. Telekatur. coming to you from medpracticeguru.com, proven practices for doctors and other providers from a doctor. Appreciate it. Thank you for your time. Take care.